For years, you have probably heard that type 2 diabetes is a progressive condition. Once you get it, your best case scenario is managing it carefully with medication and lifestyle changes for the rest of your life. But what if that assumption is based on science that is now outdated? What if the real evidence shows something far more hopeful? Welcome to Longevity Lab. I'm Claire.
And I'm Robert. Claire, I have to tell you, when I read the research you sent me for this episode, I actually sat down. I had to read it twice because my entire understanding of type 2 diabetes just got turned upside down.
I love hearing that. And I think a lot of our listeners are going to feel the same way. Because for decades, the dominant medical narrative has been that type 2 diabetes is a chronic, progressive disease from which there is no return. And that narrative is just not aligned with what the best quality clinical research is now showing us.
Okay, so before we go any further, I want to get this clear in my head. When we say reversal, what are we actually talking about? Because I have heard people use the word remission. I have heard reversal. I have heard cure. And I think for a lot of people, these words mean very different things.
That is such an important distinction, Robert, and you are right to call it out because precision in language matters here. So let me define what the research community now generally agrees on. When we talk about type 2 diabetes, reversal or remission, we are not talking about a cure in the sense that the disease is gone forever and you can go back to your previous lifestyle with no consequences. That is not what the evidence shows. What remission means is that your blood sugar levels return to a non-diabetic range without the need for glucose-lowering medications. And this state is sustained. The most widely accepted definition, and this comes from the American Diabetes Association, is that your hemoglobin A1C, which is your average blood sugar over the past 3 months, drops below 6.5% and stays there for at least 3 months without any diabetes medication.
Let me make sure I understand this correctly. So my blood sugar levels are essentially back to normal. My body is regulating glucose the way a non-diabetic person's body would, but I still have to be careful.
Exactly. And that is the crucial nuance. Remission means your body has regained enough metabolic function to maintain healthy blood sugar levels on its own, but the underlying predisposition is still there. If you go back to the dietary and lifestyle patterns that contributed to the condition in the first place, the diabetes will very likely return.
Okay, that makes sense. It is like losing a significant amount of weight. You have to maintain the new habits to keep the weight off. The body remembers.
A perfect analogy. And it brings us to the single most important piece of evidence I want to share with our listeners today. There is a research program that has been running for over a decade now, led by Professor Roy Taylor at Newcastle University in the United Kingdom. And his work has fundamentally changed how scientists understand type 2 diabetes.
I've heard of this. Is this the low-calorie diet study?
It is, and the results are extraordinary. But I want to walk through the science step by step because the mechanism is actually one of the most beautiful examples of how the human body can heal itself when given the right conditions. So here is what Roy Taylor and his team hypothesized. They proposed that type 2 diabetes is caused by the accumulation of fat inside the liver and inside the pancreas. Not the fat you can see on your body, but the invisible fat stored inside these organs. And this intra-organ fat disrupts the normal function of these organs. In the liver, it causes insulin resistance. In the pancreas, it damages the beta cells that produce insulin.
So you are saying that the organ fat is the root cause, not the body fat itself.
That is exactly right. And this was a revolutionary idea when Taylor first proposed it. Because for years, the medical establishment believed that once beta cells in the pancreas were damaged, that damage was permanent. The idea that the pancreas could recover function if the internal fat was removed was considered highly unlikely.
And the research proved otherwise.
Dramatically so. In 2011, Taylor published his first major study called Counterbalance. He put participants with type 2 diabetes on a very low-calorie diet of around 600 to 800 calories per day for 8 weeks, and what they found was stunning. Within 1 week, blood sugar levels had normalized, and by the end of the 8 weeks, the participants had lost an average of about 15 kilograms, which is about 33 pounds, and their pancreas function had measurably improved.
Wait, within 1 week? So on day 7, their blood sugar was already normal?
That was what surprised even the researchers, because it suggested that the improvement was not simply a result of weight loss. The rapid reduction in calorie intake, particularly the reduction in carbohydrate and fat, immediately reduced the fat content of the liver and pancreas, and that allowed the organs to start functioning properly again almost immediately.
That is incredible. But here is the question I have, and I suspect a lot of our listeners are thinking the same thing. That 600 to 800 calorie diet sounds very extreme. Is that safe? Can a person do that without medical supervision? Because that sounds like something you would do in a hospital.
You are absolutely right to flag that, Robert. And this is the most important message I want our listeners to take away. The Newcastle Diet Protocol, as it is called, was conducted under strict medical supervision in a research setting. Participants were monitored closely for electrolyte imbalances, blood pressure changes, and other potential complications. This is not something anyone should attempt on their own. But here is what is really exciting. Subsequent research has shown that you do not need to go to such extreme levels to achieve remission. A more recent study, published in 2023 in The Lancet, followed 2,500 participants with type 2 diabetes, and they used a structured low-calorie diet of around 800 to 1,000 calories per day for the first 12 weeks, using meal replacement products. Then they gradually reintroduced regular food while maintaining calorie control. And after 12 months, nearly half of the participants had achieved remission.
Half. So 1 in 2 people who followed this protocol no longer had diabetes medication. That is a clinical trial with 2,500 people. That is not a small pilot study. This is real evidence.
It is real evidence, and it has been replicated. The Diabetes Remission Clinical Trial, or DIRECT study, which was published in 2018 and followed participants for 2 years, showed the same pattern. At 1 year, 46% of participants were in remission. At 2 years, 36% were still in remission. And the key predictor of success was weight loss. Those who lost 15 kilograms or more had the highest rates of remission.
So the single most important factor is how much weight you lose, specifically from those internal organs.
That is the mechanism, yes. But I want to be very precise here. It is not just any weight loss. It is the loss of fat from the liver and the pancreas. And this occurs most effectively when you reduce calorie intake significantly enough to create a negative energy balance that forces the body to use those internal fat stores for fuel.
So let me see if I can explain this back to you in my own words, and please correct me if I get it wrong. The liver and pancreas accumulate fat, which causes insulin resistance and reduced insulin production. When you lose weight, particularly through calorie restriction, the body starts burning that internal fat. As the fat leaves the liver and pancreas, their function improves. And at a certain point, the pancreas produces enough insulin and the liver responds to insulin properly and blood sugar normalizes.
That is textbook correct. I could not have explained it better myself. And the reason this is so important for our listeners is that it changes the entire framing of type 2 diabetes. It shifts it from a chronic, irreversible condition to one that is potentially reversible through metabolic intervention.
But I know there is a catch, because there is always a catch. Not everyone can do this. Not everyone will respond the same way.
You are right, Robert, and this is where the nuance matters a great deal. The research shows that the best candidates for remission are people who have had type 2 diabetes for a shorter duration, typically fewer than 6 years, people who have a higher baseline body weight, and people who are able to achieve and maintain significant weight loss. People who have had diabetes for more than 10 years, or people who are already at a healthy body weight, are less likely to achieve remission through diet alone. Additionally, people with type 1 diabetes, which is an autoimmune condition where the pancreas produces no insulin at all, cannot achieve remission through lifestyle changes.
That last point is extremely important. I think a lot of people hear about diabetes reversal and they assume it applies to all diabetes, but type 1 and type 2 are fundamentally different diseases.
They are, and confusing them can be dangerous. Type 1 diabetes is an autoimmune condition where the immune system destroys the insulin-producing cells. No amount of weight loss will bring those cells back. Type 2 diabetes is largely a metabolic condition driven by insulin resistance and progressive beta cell dysfunction. And it is the beta cell dysfunction that can potentially be reversed by removing the fat that is impairing their function.
Okay, so for the person listening at home who has type 2 diabetes and they want to understand what they can actually do, what is the practical takeaway from all of this?
I am glad you asked that because this is where the research translates into action. And I want to be extremely careful here because I do not want anyone to go and attempt a starvation diet on their own. Let me give you the evidence-backed approach. The first step, and this is non-negotiable, is to talk to your doctor. Tell them you have heard about the research on type 2 diabetes remission. Ask them to check your current A1C and your current medication regimen, because if you are on certain diabetes medications, particularly insulin or sulfonylureas, reducing your calorie intake significantly without adjusting your medication can cause dangerously low blood sugar.
That is a legitimate medical emergency. So anyone listening, do not start reducing your calories dramatically until you have had that conversation with your healthcare provider.
Exactly. Do not start this alone. But once you have that medical clearance, the evidence suggests that a structured approach to weight loss is the most effective path to remission, and structured is the key word here. The direct study used a specific protocol. For the first 12 to 20 weeks, participants consumed a low-calorie diet of 800 to 1,000 calories per day using meal replacement products. These were nutritionally complete formulas that provided all the vitamins, minerals, and protein the body needed while keeping calories very low. After that initial phase, they gradually transitioned back to regular food over a period of 6 to 8 weeks. And then they entered a long-term weight maintenance phase.
And this whole process was supported by a trained healthcare professional.
Correct. The participants had regular contact with dietitians or nurses who provided education, support, and accountability. This is not a do-it-yourself project, but the principles can be applied in a more moderate way.
Walk me through that. What does a moderate, evidence-informed approach look like for someone who cannot access a structured program?
Great question. So let me give you three specific actionable strategies that are supported by good evidence. Number one, and this is the most effective single intervention for improving metabolic health, reduce or eliminate added sugars and refined carbohydrates. This is not a permanent ban on carbohydrates, but it is a significant reduction in the types of carbohydrates that spike blood sugar the most. Think sugary drinks, white bread, white rice, pasta, pastries, sweetened yogurts. When you replace these with whole food sources of carbohydrates, vegetables, legumes, whole grains, your body processes them much more slowly. Your blood sugar stays more stable and your insulin levels drop.
That makes sense. And it is consistent with what I have heard about low glycemic index eating.
It is related, but I would emphasize that the research on diabetes remission points more toward total calorie reduction than specific macronutrient composition. That said, when you focus on whole foods and minimize processed foods, you naturally reduce your calorie intake without feeling deprived. Number two, increase your protein intake at breakfast. This is a specific, concrete change that has been shown to improve blood sugar control throughout the day. A breakfast that contains at least 25 to 30 grams of protein, think 3 eggs or a protein shake, or Greek yogurt with nuts, helps stabilize blood sugar and reduces cravings later in the day.
Interesting. So the first meal of the day sets the tone for the rest of the day.
It does. And this is supported by research on the second meal effect, which shows that your blood sugar response to lunch and dinner is influenced by what you ate at breakfast. Number three, incorporate resistance training into your weekly routine. And I am not just saying this because exercise is good for you. There is specific evidence that building muscle mass improves insulin sensitivity. Muscle tissue is the primary site where your body stores glucose after a meal. The more muscle you have, the more glucose you can clear from your bloodstream. And resistance training, think weightlifting, bodyweight exercises, resistance bands, is the most effective way to build and maintain muscle mass.
And this is separate from the weight loss we talked about, correct? Because I know some people who are at a healthy body weight but still have type 2 diabetes.
That is such an important point, Robert. Building muscle improves insulin sensitivity independent of weight loss. So even if you are not trying to lose a significant amount of weight, increasing your muscle mass can directly improve your blood sugar control, and it works through a different mechanism than the calorie restriction we discussed. Calorie restriction reduces the fat in your liver and pancreas. Resistance training improves how your muscles respond to insulin. Together, they are synergistic.
I love that. So there is not a single silver bullet, but there are multiple things you can do that all work together.
That is exactly the right way to think about it. And this brings me to a case study that I think will really bring this to life for our listeners.
I am ready. Give me the story.
Let me tell you about a participant from the direct study. I will call him John. He was 52 years old when he enrolled in the study. He had been diagnosed with type 2 diabetes for about 4 years. He was on 2 different medications for his blood sugar, metformin and a sulfonylurea. His A1C at the start of the study was 7.8%, which is above the diabetic threshold. John was assigned to the intervention group. He followed the low-calorie meal replacement diet for 17 weeks. He lost 16 kilograms, which is about 35 pounds. By week 6, his fasting blood sugar was already within the normal range. By week 17, his A1C had dropped to 5.9%. He was taken off both medications.
He was off medication in 17 weeks.
Yes, and the study followed him for 2 years. At the end of 2 years, he had regained about 4 kilograms, 9 pounds, but he was still in remission. His A1C was 6.2%. He was still off medication. And he reported that his energy levels, his sleep quality, and his overall sense of well-being had improved dramatically.
That is the kind of result that gives people genuine hope. And I think that is the message that needs to get out there. Not false hope, not quick fixes, but real evidence-based hope that shows what is possible when you approach this condition with the right science.
And I think the most powerful part of John's story is that he did not need to maintain that extreme calorie restriction forever. The initial intervention was aggressive, but the maintenance phase was much more moderate, and he was able to sustain his results.
One question, Claire. For people who are listening and thinking about this for themselves or a loved one, what is the timeline they should realistically expect? Is this a 3-month process, a 6-month process, a year?
That is a very practical question, and the answer depends on your starting point. But let me give you a realistic framework based on the research. The initial phase of rapid weight loss, where you see the most dramatic improvements in blood sugar, typically takes 8 to 12 weeks. This is the phase where you are losing weight most rapidly, and the internal fat is being mobilized. Many people will see their blood sugar normalize during this phase, and they may need to reduce or stop their medications under medical supervision. The second phase, the transition to maintenance, takes another 4 to 8 weeks. During this phase, you gradually reintroduce regular food and find your long-term eating pattern. This is where many people struggle because they have lost the structure of the meal replacement plan. And the third phase, weight maintenance and long-term remission, is ongoing. The research shows that the people who maintain their remission at 2 years are the people who continue to eat a lower calorie diet and who have maintained most of their weight loss.
So it is a marathon, not a sprint, but the finish line is real.
It is definitely a marathon, and I think that is the honest truth that the wellness industry often avoids. There is no magic supplement, there is no 1-week cleanse that reverses diabetes, but there is a well-documented, scientifically validated path that for many people can lead to genuine remission.
Before we wrap up, I want to ask you about a concern I have heard from people. Some say that calorie restriction is dangerous for older adults, that we need more nutrition, not less. How do you respond to that?
That is a legitimate concern, Robert, and it is one that healthcare providers consider seriously. Malnutrition is a real risk in older adults, and anyone who is over 65 or who has other health conditions absolutely needs a tailored approach. But I will say this. The research on diabetes remission has included participants in their 60s and 70s, and the outcomes are similar to younger participants. Provided they are otherwise healthy and they are monitored appropriately, the key is that the low-calorie diet must be nutritionally complete. That is why the meal replacement products used in the trials are specifically designed to provide all essential nutrients while restricting calories. If you are an older adult considering this approach, and this is true for anyone, the conversation needs to happen with a doctor who can evaluate your specific health status, your medication regimen, and your nutritional needs. And I would add that if you have a history of eating disorders, or if you are already at a healthy body weight, a very low-calorie diet is not appropriate.
That is very clear. So the message is not everyone should do this, but for many people with type 2 diabetes, especially those who have had it for less than 6 years and who have excess weight, this is a path worth exploring.
That is a fair summary, and I would add one more group. People with prediabetes. If you have prediabetes, which is defined as an A1C between 5.7 and 6.4%, the evidence for preventing progression to full diabetes through weight loss and lifestyle changes is even stronger. You are essentially addressing the problem before the beta cells have been significantly damaged.
So the earlier you intervene, the better your chances.
The earlier, the better. And this is where prevention is truly powerful. Because once beta cells have been damaged over many years, the potential for recovery diminishes. But even then, we are seeing evidence that some recovery is possible.
Claire, I want to be honest with our listeners. I have a close friend who has had type 2 diabetes for about 15 years. He is on insulin now. When I told him about this research, he was skeptical. He said, I have been told by my doctor that my pancreas is burned out, that this does not apply to me.
And your friend may be right. 15 years of type 2 diabetes is a very different scenario from 4 years. The research on remission and long-duration diabetes is much more limited. But I will say this, even if full remission is not achievable, significant improvements in blood sugar control, reductions in medication dose, and improvements in overall health are possible at any stage. The benefits of weight loss, improved diet quality, and increased physical activity extend to everyone with type 2 diabetes, regardless of disease duration.
So even if you cannot achieve full remission, you can still win.
Absolutely. You can win in many ways. Better blood sugar control means fewer complications. It means better energy. It means reduced risk of heart disease, kidney disease, nerve damage, and those are victories worth celebrating.
I think that is the note I want to end on, because I know some people might feel discouraged if they cannot achieve full remission. But the point is that every improvement you make matters. Every pound you lose, every mile you walk, every vegetable you eat is making your cells healthier.
And that is the heart of longevity science. It is not about perfection, it is about consistent evidence-informed choices that add up over time. So let me give you the takeaway from this episode. If you have type 2 diabetes, or if you are at risk, here is what the science says. Type 2 diabetes is not necessarily a one-way street. For many people, particularly those with shorter disease duration and excess weight, remission is achievable through significant sustained weight loss. The mechanism is the reduction of fat in the liver and pancreas. The most evidence-backed approach involves a structured, medically supervised low-calorie diet, followed by long-term weight maintenance. But even if full remission is not your goal, every improvement in diet quality, every increase in physical activity, every pound of weight loss, every gram of muscle you build will improve your metabolic health and reduce your risk of complications.
That is empowering. And I think at our age, Robert, knowing that we have that power, that our daily choices can actually reverse a disease that we thought was permanent, that is what keeps me coming back to this show.
And that is what keeps me in this field. The science is evolving and the story is getting more hopeful.
If you enjoyed this episode and if you found it as eye-opening as I did, please take a moment to subscribe to Longevity Lab. New episodes drop every single day. And if this episode helped one person understand their health differently, that is the whole point of what we are doing here.
And of course, if you have any questions or thoughts about today's episode, leave them in the comments. I read every comment and sometimes I answer them in future episodes.
Until next time, Claire, thank you for giving me a whole new way to think about diabetes.
Thank you, Robert. Until next time.
Today's rule: your body has more capacity to heal than you have been told.